Okay, I just got a call that in the ED that the patient is, I'm going to need to manually ventilate a patient. So on my way, I'm going to make sure I have an Ambu bag and that I'm going to bring some different oropharyngeal airways for the size. The patient, I also looked up her chart. She doesn't have any facial or neck injuries, so if there was, I would make sure to use proper protocol with making sure spinal precautions. So I enter in that patient's room. I go ahead and wash my hands, put on gloves. The nurses are all about her right now. And I bring over my oropharyngeal airways to see what's going to properly fit. So the first one is going to sit here. It should go from the tip of her mouth to the tip of her ear, and that one's way too short, so we're going to go ahead and test this size. And this one looks like it's going to be right there. Perfect fit for Mrs. Smith. So I try to introduce myself, but Mrs. Smith isn't responsive. Mrs. Smith, yeah, she's gasping a little bit, spontaneous breaths, but not maintaining adequate airway. So we're going to go ahead and insert this. I'm going to do a chin tilt, push back on her forehead, chin tilt up, and I'm going to insert this upside down, pushing her tongue back. As soon as I get halfway, I'm going to turn 180 degrees and insert. Now the flange is resting right on her mouth there, and the airway is secure. So then I can go ahead and set up my Ambu bag on oxygen fill here, turn it on, and I'm going to go ahead and make sure I have a tight seal around the patient, chin tilt up, making sure I have a clear airway, securing the seal. I'm going to start administering some breaths here. What I'm looking for is adequate chest rises. So with that, I may have to pull back patients down here. You can see that we're getting some chest raises with that. We want to let the bag, make sure the bag refills on its own so we get maximum oxygen percentage here. And we want to administer breaths, 12 to 20 breaths per minute. I'll go ahead and show you what that rate would look like. Let's go ahead and do 12 breaths per minute. It's about 12 breaths per minute.